And joining us now is In Focus health correspondent Linord Moudou. What do you have for us today, Linord?
Hello, Vincent. Well, today it's all about maternal health. Every day, approximately 800 women die from preventable causes related to pregnancy and childbirth. The World Health Organization says 99% of maternal deaths occur in developing countries, and more than half of them are in sub-Saharan Africa. With some 163 million people, Nigeria accounts for 2% of the world's population and contributes to at least 10% of global maternal death. But observers say some progress have been made locally with regards to maternal health. And in Ondo State, Western Nigeria, an innovative program has been recognized by the international community, international observers, including the World Bank, as a promising model in achieving the Millennium Development Goals to reduce child and maternal mortality. I spoke to Dr. Dayo Adeyanju, he is Ondo State's Commissioner for Health, and asked him what has made the success of the Abyei Safe Motherhood program.
Our strategy has been to look at the delays predisposing to maternal death. There are about 4 delays that lead to maternal death. The first one is the fact that there is always delay, in seeking health care when complication arises. And the second one is the fact that there is a delay in reaching health care. And the third one is the fact that even when they get there, there's a delay in receiving health care. And the last one is the fact that there's a delay in referring for specialized treatment. And all of these 4 delays are what we have premised our Abyei Safe Motherhood on. And before we started, we embarked on what we call a baseline study. The baseline reveal, one significant thing is that only 16% of those who will come to your antenatal care will eventually come back to deliver. That explains that 84% will be going through all those delays we have mentioned, and they might end up in other places we really cannot ascertain the skill of those who will be taking the delivery. So all of this, give us an insight into the fact that what is critical is that we need to track them and ensure that we reconnect them back to the health facility.
How do you track them? Let's talk about this woman in the rural area where there is not even a main road that goes there. Right. How do you track them, or how is she able to access the facility?
After the baseline study, and we were able to now register all pregnant women in that local government, we then assign them to people that we call the health rangers. These are community health extension workers, and then they ensure that we assign 25 pregnant women for one health ranger. That health ranger will ensure that they track them, ensure that they do their birth plan, they use the customized checklist. For those who are likely going to have a complication, then we'll do what we call the complication readiness. And what that means is that you see a woman that is short stature, she will have a small pelvis and a big baby. There's no way that baby is going to come out. Yes. So there is need for you to do a birth plan and say, you know what, when you have contraction, you need to give us a call. And we gave all those pregnant women mobile phone. So that way they can always track them, they establish rapport. So then they remind them of immunization, emphasize to them family planning, the use of insecticide-treated nets to prevent malaria in pregnancy, which again we know constitutes percentage in maternal death. And then apart from that, each of those ranger outlets, we give them the tricycle ambulance. That will eliminate delay in reaching healthcare. And the tricycle is such that if you find a woman that has a head on perineum, that means the baby is already coming out, you take the delivery right in there.
So the head rangers are
trained to do what to understand basic obstetric care. But at the basic health center, you have midwives. And then at the comprehensive health centers, you have doctors that can do cesarean section and all of that. And then we have at the specialist hospital, general hospital, those are, level of care.
Looking at what you have accomplished, it sounds like it's easy, but of course, we know it's not easy. So tell us about some of the challenges that you have been confronted with.
Scaling it up. A great challenge in the sense that it's capital intensive. And the other challenge is how do we sustain all of this? Another one is the fact that, of course, you always have a paucity of personnel to be able to go around. But we have put in place some strategies like tax shifting, and because for every 100 women, only 20% will require the attention of a doctor. The remaining 80% will go through normal delivery. So why should a doctor be busy doing normal delivery when he should be busy doing cesarean section? So that is what we call tax shifting. But what we put in place is protocol management and then clinical guidelines. Another thing is that strengthening the health management information system to be able to generate, adequate statistics that will form evidence for improving. And that was why, again, we launched what we call CHEMDOS, which is Confidential Inquiry into Maternal Death. Mother and Child put in place has succeeded in seeing more than 57,000 patients in the last 3 years. And then we have, again, been able to see more than 26,000 children under 5. But all of these have succeeded in reducing maternal mortality by 15% annually since 2010. So if we sustain what we are doing, the implication is that by 2015, we will definitely be able to boast that we have achieved MDG, because 15% per year will translate to 75%, which is the mandate. The governor has been so passionate enough to see that first and foremost, we must ensure that pregnancy is not a death sentence in Ondo State.
Under the Abyei Safe Motherhood program established by Governor Olusegun Mimiko, services are free of charge for all pregnant women and children aged under 5. Across Ondo State, Vincent, back to you.
Well, thanks a lot, Lino, and remember to join Lino right here every Tuesday and Thursday.